Good morning, everybody. I'm Robin Strongin with Health Dame, and I'm very excited today. Well, first, Happy New Year to everyone. This is our first 2026 interview. And what better topic than kicking off the new year than menopause? And it seems that menopause is having a moment, literally. And if you just type the word menopause online, you get article after article, and they all seem to have the headline that says menopause is having a moment, which I find very interesting because when I was going through menopause 1,000 years ago, no one really talked about it. There was, and probably continues to be, quite a bit of stigma and shame and confusion. Um, and there's a lot of ageism associated with the whole idea of menopause. But I'm excited to be able to introduce Dr. Sarah Berg with us, who's going to walk us through what menopause is, what we need to know about it, and how women and their partners can advocate for themselves. Because although it can be funny at times, and it's sort of, there's a lot of comedy shticks around menopause, it's really not a punchline at all. And it is a really important part of a woman's lifespan. And so, here with us today to make sense of this whole concept, notion, condition, what have you, of menopause, we have Dr. Sarah Berg. You are a certified OBGYN obstetrician gynecologist with more than a decade of clinical work and experience caring for women across the age span. But you really specialize in menopause. That is your area of expertise and midlife women's health, with a focus on an area that's near and dear to me, which is patient advocacy. And I know that through your clinical work, writing, speaking, that you work really hard to translate all of the complexities in medical science so that we, on the other end, can start to have the information we need and to understand it and be able to ask questions with our health professionals. And so, welcome to Health Dame, Sarah. It's great to have you here for this really important discussion, which I think is, as I said at the top, very, very timely. Um, what I'd like to do is just have you share a little bit about yourself. It's always really interesting to me, anyway, why you went into OBGYN and why menopause. What is it about those areas that drew you in when you were in med school, let's say?
Well, first of all, thank you so much for having me on. I'm really excited to have this conversation. And I think you are such an advocate for people and women. I think it's so exciting to be able to have it with you because I know
Thank
the people
you.
listening are going to really kind of take this in and move. And that is what that's what I'm thrilled about.
Great.
Um, I'm not that exciting, but the information is, but just so you'll have a little knowledge about me. So when I was in medical school, you in the third year is when you kind of go through all the rotations and figure out what you want to do with your life. And my very first rotation was OBGYN.
No.
And I come from a family of doctors, and my dad is a cardiologist, and he hated OBGYN because it's a little all over the place. It's
Yeah.
scattered. You're doing surgery in the morning, maybe delivering a baby at lunch and doing clinic all day. So
Oh,
it's
I see.
you're not in one segment ever. And for someone who likes to live in a box, that was scary. But as women, most of us know we're great multitaskers. So it was fun. It felt like a good fit. Never the same thing every day,
Sure,
which is
sure.
exciting. But then also, like you said about that, you've said before about doctors starting to look a little young. When I was in training, I was in my 20s, but I looked 12 on a good day.
Yeah.
And so there was also the idea that in that rotation, women were willing to bet on me and take time with me and trust me, and I
The
could build
patients
that
were.
relationship. The patience
Ah,
that I
got
was
it.
seeing, I could build that relationship in a way that I didn't really feel I could in other rotations. And as a woman, it is always interesting to learn more about what's going on in my own body. And that's what it's about. I mean, I always tell women in the office all the time when they feel like they can't believe they don't know something or they're shocked about something. I'm like, I did 4 years of medical school. 4 years of residency. The only thing I do all day is talk about women's health and care and learn about women's health. And I'm still learning things all the time. So no one should ever feel ashamed if they didn't come out of the womb knowing something about themselves.
But do you
And
find that it's hard for, I'm guessing it is hard for some women to ask questions, whether they feel like they should know something or, they feel awkward about it, or particularly in gynecology. I mean, that one is fraught with all kinds of, I would think, challenges in particular. And as a physician, you're probably there trying to help them ask the questions, I suppose.
absolutely. And that's one of the things I love about gynecology is that you build relationships. So they
Hmm.
may not feel comfortable asking the first time, even though I wish they did. But
Right.
it may be 2 or 3 visits in, they're like, this person's not going to judge me. This person's going to care for me. And another thing I used to always tell people is, I mean, you have to get dressed in a gown. You lose your like things, your security blankets. I
Yeah.
would say I make people get undressed and talk about their feelings. Like there's nothing more vulnerable than that.
Right. Right.
And that's what the office visit is about. It's about feeling vulnerable, but feeling cared for. But if you don't have that good relationship with your physician or your clinician, it's hard to broach those topics. Just like you're saying, it's uncomfortable. And some of them feel really uncomfortable because they're so personal.
Do you notice a difference in women who are approaching menopause age in terms of their comfort level? They've been through their first, gynecologic exam. They've been through perhaps some childbirth or fertility issues. So they're more comfortable in stirrups by the time they're approaching menopause. But are they more comfortable in asking questions, or it's really a very individualized thing and generational, or is that changing? I just find it fascinating because I'll talk about virtually anything to anyone.
Mhm.
I just don't have barriers. I probably should have more filters, but a lot of people really are not comfortable, just putting it all out there.
I would say actually it's the opposite because there's so much issue with ageism and shame. Even women that were very open with me earlier in their life venture and fertility,
Interesting.
they feel so insecure about what's going on. It's almost that pullback. I call it the rounding of the shoulders, the looking down instead of looking at me. I would see that all of a sudden. And you really have to pull to get those questions out of them because they're having, I mean, anyone who's been through some of the changes that looks back on it, they may be not the same person in that life frame than they were 10 years before and
That
10
makes
years
a lot of
after.
sense. So for purposes of this conversation, I always like to get a level set with some definitions. So when
Mhm.
when you as a clinician talk about the word menopause, I know there's, perimenopause, menopause, blah, blah. What should we know so that we know what we're all talking about on a sort of even keel here?
I love that question because I feel like so many women are scared to ask. They assume they should know again. So they don't even want to ask what is the basics. And
Okay.
we'll start with perimenopause. Perimenopause is the transition. It's when your hormones are starting to shift towards the lower level of estrogen and the lower level of progesterone, but your brain is working hard to keep in the
Uh,
normal stage of cycles every month. So it's ramping up and telling you, send out those hormones, send out those hormones. So sometimes you have estrogen out the wazoo, and sometimes your estrogen is on the floor, and it's day to day. So it feels and you feel a lot of times all over the place. Now, everyone doesn't feel the same in it, but that's usually the ping-ponging hormone stage. And it can last for some women over a decade. So it's not short and it's not fast. And for many women, it hits them before they would expect to think about menopause. So late 30s, early 40s. And so they feel like they're, and the words they use with me is going crazy. Um,
Well, because I think for many women, they think menopause means absence of periods. And if you're still getting a period, but you're ping-ponging, it's confusing to like figure out because there's these like gross overgeneralizations, I think.
Yes. And because really menopause, I call it the least exciting part of the journey. It is only, the definition is 12 months after having a cycle. period. If you've gone one full year without a cycle, that is your day of menopause. And more complicated for women who've had hysterectomies or their uterus is out, so they don't have the bleeding as a sign,
Right.
but that's the sign. And so menopause literally means stopping periods. And then postmenopause is like 30% of your life. Most women spend a huge portion of their life after menopause. So now that their hormone levels are at a different state, it's their new normal. And so learning how to live in that new normal.
Is it
And
like adolescence where it's this transition and it's sort of like preteen and then teen and your body's changing and it's hard to like pinpoint suddenly? So it's not like this one singular event happens unless maybe there's surgical something or other that's pushing you into menopause, but that's different than in a natural state, I suppose.
yes, absolutely. And they for a while the big phrase for it was uh, cougar puberty. And I thought that
Oh,
was it sounded really, I didn't love the name, but it's true. It's like you are having
I
the
never heard that
opposite.
before. I
Oh
knew
my
what a
gosh.
cougar was, but I didn't hear that put together like that.
Oh my gosh, I hated it. I don't like the name cougar, but it was a
It did the
joke
trick.
going on. It explained it because it really is that kind of as you're in those like 11 to 15 years old, everything's ramping up and the hormones are going all over the place. This is the same on the other end. It's just the bell curve going on. And
Oh my
so we're
God.
on the other side of it. And the fun thing is a lot of women are having these at the same time if they have like preteens and teens. So it's just this fun cycle all together.
Well, this is where some of the punchlines and the comedians come in. If they're male, and typically it
Mhm.
starts out with, in my house, I have a 15-year-old and my wife. And then it
Mhm.
like sort of they go from there and everybody is, laughing because there is a sense of relatedness. But while it can be funny when someone's doing improv, it's a medical situation that women need to take seriously because it affects everything from bone health to mental health to reproduce, everything. So when you're helping women kind of go through and understand the process, what do you want women to know about this phase of their life? Like what's really important?
So I would say, and we're, especially thinking about women advocating for themselves, the number one thing women should do in preventive care is educate themselves on themselves. I hope every woman thinks she is the most important person in her life. And I know that's not true, but at least get on the top five of your own list. And think about how if your child was having something or your significant other was having something, how much you would educate yourself what was going on. And
Hmm.
so if you think about yourself, just think about yourself, think about what's going on, what symptoms are happening, what am I doing around those symptoms, what medications am I on, why am I on those medications. Just thinking about themselves can help them come in to their clinician's office with information and with self-awareness so that they can say, hey, this is what's going on, and not have to wait for a question to be able to kind of pull out what's going on in their body. And I think that can also help. Sometimes people get confrontational or feel like they have to like yell, this is what's going on. But if you know what's going on with yourself, you can have more of a conversation with people around you. And that could be your significant other because they need to know what's going on in your body. And if you are educated on yourself, you can educate those around you. I've had a lot of people tell me, and I love this, they just say it out loud like, hey, I'm having a hot flash, so you don't want to talk to me in this exact moment. And feeling the confidence to do that at work with their kids, with their significant other, with their friends on a walk, that is important. Just saying it out loud can take away some of the like, why was she in a mood today? What was going on with her? And that background chatter that goes around it.
Yeah, for sure. And in fact, I will share that I had my own say it out loud moment because this is again many years ago. We were planning a family vacation over the summer, and my kids were pretty grown. They were still in I want to say high school. But we were planning a trip and we had wanted to go to Greece for a very long time. So we had started planning this trip like earlier in the year, and we were going in the summer when the kids were out of school. And as the year progressed, and my menopause symptoms progressed somewhere around April or May. And Brian, my late husband, kept referring to me as a human heat shield. And, he looked at me and I looked at him and I'm like, why are we going to Greece in the summer? I'm already
Hot.
at like, sun temperature. Now we're going where it's really hot. And if mama's miserable, y'all are going to be pretty uncomfortable too. And so he looked at me and he goes, well, what do you want to do? Be on a glacier? And I'm like, that's it. We're
Hmm.
going to Alaska. So we pivoted our Greece trip and we ended up calling it Mom's Menopause Cruise. And we did indeed go to Alaska and it was fabulous. But I'm glad I spoke up because I think I would have evaporated had I gone to Greece in the blistering heat. I would have been so miserable. I would have made everyone around me miserable. Because normally, you suck it up for the good of the family. But at that point, I was like, absolutely not. This is just not going to end well. And so, we were able to go and literally be on a glacier, and I was really happy. Everyone else was a little bit chilly, but I was like in my element. It was I will say this, it was one of our most memorable trips. So it was beautiful. But, more power to people to try to figure out how to work with what's happening. But it's not easy.
Oh, and it's not. And it takes, look, it was that idea. You said, hey, I'm putting myself on the list. Like, I'm not going to just suck it up for the family
not for
because
this.
everybody will be miserable. And it's a lot of money invested. It's a lot of
Right.
time. You should also enjoy yourself. And I love that. That's the exact thing I'm saying. You just put yourself on the list and you say it out loud. And look what the difference is. You had a lifetime event that was so much better.
It was really something. And, we eventually made our way to Greece and it was spectacular, but I was able to enjoy it when we went.
Yes.
And so it all, all's well that ends well. But what are some of I know one of the issues, and we could spend 3 days on this, so I don't want to dive down, but along with the confusion, one of the issues that has gotten probably more attention than anything is hormone replacement therapy as it relate or treatment as it relates to menopause. And it's hard when you're the patient, the consumer, because you appreciate that science is always evolving. The evidence is always being improved and improved upon, but it is confusing when you're trying to make good decisions. It's scary. You don't want to, so what are there either questions or resources or sites that you recommend to women and their partners for getting more educated about some of these issues, be it HRT, hormone replacement, or other menopause related issues?
Yes, and I
Okay.
think that's a great question because we're learning so much from algorithms that we're just getting these like headlines. And we really need these evidence-based sources that are out there that they're just not screaming in the way that algorithms are screaming at us.
Fair
And
enough.
and if you have places to go that are just the data, I mean, they may not be the most exciting reads in the world, but they are informative and worth
Sure.
taking a look at. So the Menopause Society literally where menopause providers get credentialed to be caretakers for menopause has great patient handouts and patient information on
Oh, that's great to
all the
know.
things you could think about. ACOG, which is American College of Obstetrics and Gynecology, they have patient information. They just actually came out with a patient book on like, here's
Oh,
everything to know about menopause. And Mayo Clinic has great online resources, and they've done so many studies that are fabulous. And I'm not trying to self-promote, but I made a course because I think it was hard to read those kind of dry papers and I wanted to bring it to life. And so I made an evidence-based course that's like a master class on menopause
so
about just
talk a
everything
little
you should
bit
know.
about that. What is it called?
So it's called, so my umbrella name is Self 40 because it's all about women health prioritized. So again, putting yourself on the list, putting yourself
Yep.
first. And so it's about all of women's health, but where I'm focused now and most focused because I think it needs the most focus is menopause care. And so I came in with a menopause explained course, which is it has just explaining about menopause. It's very about anti-shame, how to feel empowered, how to talk about things, hormone therapy, non-hormone therapy, physical activity, nutrition, what it's doing in your brain, what it's doing in your heart, what it's doing in your sex life, like
Right.
all out there, and you can kind of pick and choose where you want to learn. So
That's
it's
amazing.
it's
Okay,
a
so
way to
how
get
do
the
people,
evidence.
where do people go to find that? And we will put all of this on the
Oh,
healthdame.com website. So we'll have the
oh,
links up there to both the Menopause Society, it was Mayo, it was
and ACOG.
Sorority, and ACOG.
Yes.
Yeah.
So on my website, you can click in on the course, and I also made a shorter one just as an intro as well, like menopause essentials.
Okay.
But then I also, because I enjoy educating and I really love sharing, I have a Instagram and I'm on LinkedIn and I'm on
Fabulous.
Facebook. Just
Okay.
ways, and those are just me sharing myself, me sharing how I feel about what's going on, and a lot of education. So in little short bits, and it's all evidence-based and it's not clickbait. It's really just fun ways of explaining unusual topics.
Wow. And in terms of patient advocacy, are there any advice about what not to do? Like when you're going into your doctor's office and you're advocating for yourself, is there sort of something that when you were seeing patients you would prefer they not do and it didn't move the needle forward?
Um, that is a good one. The main thing was, I think, the idea of confrontational, and that's hard because a lot of women came to me after maybe seeing five people telling them that what they're dealing with is just something they have to deal with. So they
So
come
they're
in
frustrated by the time they get to
frustrated.
you.
Yes,
They
and
want
that's
answers.
and you want to give them answers, but when someone comes in upset at you to start out, it's really hard to kind of bring the conversation down. And that
Yep.
takes time away from the care. So it's that idea of thinking it more as advocating for yourself with education and power, but
Mhm.
not with the feeling of a fight.
Yep.
Because I promise you, I know there's all different people, but most doctors, and especially the doctors I know, none of us went into this because we didn't like patients and didn't like people. We really like people. The system is not perfect.
No,
It
oh, don't get me
is,
started on that one. No, it's
yes.
terribly broken.
And it's broken for us as well. And
Yeah,
we don't
a hundred
like
percent.
that we are given so little time to
Yep.
actually care for patients. And we have to do so many checkbox and we have to worry about so many things outside of this one-on-one time. And it makes it really hard for us to give you the care. And so we want to use that little bit of time we have in the office to give you everything we have and not feel like we have to fight you to give you the information. So that's really like, think of it as each doctor, it's a clean slate. So even if you had a bad experience before, clean slate it, try to bring in those ideas that you know. And again, bringing yourself to the table, saying I'm important. And I actually wrote an article about this because it was so important. I have it on
Okay.
my Substacks because it's something about how to prepare for your doctor's appointment, even though you really shouldn't have to prepare. But it's just like a list of things to think about, like
Oh, that's really helpful. Okay.
yeah. And so
Okay.
and I can send you my Substack just so that people
Yes,
can look
please
into
do, and I'll
it.
include that with all the links too. So yeah, send that to me and we'll make sure to add that. I'm making a note
Well,
because
and
I think
because
these resources are so helpful because when we're preparing to go and speak with a physician, we know there's limited time. We know that, we have sometimes if it's a group practice and you have a favorite doctor, you don't always get
mhm,
to see that person with whom you might have a good relationship. And
mhm.
if they're out delivering a baby or something and you have a covering doctor or whatever the reason is for scheduling just doesn't work out, it's hard for everyone in the system
Oh,
and time is so precious when you're in the waiting, and it's just I do think telehealth is a little bit easier in some regards. It obviously in other ways you have to be there in person. Not, it doesn't work for everything, but I know for me personally, sometimes it's almost easier to have hard conversations over the internet than in person, but that's not true for everyone. Everyone has a different kind of way that they feel more comfortable communicating. Um, so I think we covered a lot of really great territory, and I am happy that people are acknowledging menopause, talking about menopause, like, it's out there in a huge way now. It really is something else.
I, it needs to be. It
It,
needs to be. And I'm so excited. And I don't want it to be a moment. I want this to be a movement. I want this to be a progression because we're just starting.
I love that, a progression. Yeah, because I do think that, like I said, the stigma, the shame, the confusion, but also the ageism is
Yes.
really a problem, and
Mhm.
it's getting worse. And I think by tackling some of this, just because a person goes through menopause doesn't mean like they're not productive anymore. There's still value in them as a human being. They can still do a lot. It doesn't mean they're like ready for, the end of days. That is not what this marks by any stretch of the imagination. And yet, people think that way.
There's a couple of cultures around the world where the menopause and how they explain and the words they use for menopause is really about women of wisdom. And it's the way we frame culturally. And
Women
I
of
think
wisdom.
wisdom
Ho,
of
ho,
wisdom.
ho.
And those women are the most listened to in society. And they're usually the leaders of the society. And one of them is the Mayan culture. And there's a small tribe in New Zealand. And I am fascinated by that because it's the words we use. And that's why I don't love the word menopause because it's just all about stopping endings.
And it
I
starts with
like
men, but
Yeah,
okay.
yeah. But and for other cultures they talk about as a renewal or a transition. And if we can just reframe it and think about the words we use to express, like we are at our most wise. We care less about what people think about us than we did in our 20s. I don't ever want to be 20 again. I'm
Yeah,
sorry. It gets better. If anyone out here is a 20-year-old, it gets better. I love my 40 to 50-year-old self, and I love what I can bring to the table. And I'm less scared to bring it. And so
yeah.
I want to think of myself as a woman of wisdom, and I want others
I
to.
could not love that more. That is like the whole point of Health Deem. My tagline is more wisdom, less patience, more mature advocacy. Like we're not running away from it. We're embracing the fact that with age comes a lot of things. Some of them not so good, but most of them really, really good. And there is so much learned experience, wisdom, whatever you want. It's just, and to just discard it, you're doing, yourself a disfavor. I absolutely love the women of wisdom. That's
Yes.
amazing. That's
Yes. Even
really fab. What? Wow. Well,
I I
go
was
ahead.
I actually was I was writing an article and I was so excited about the idea of thinking of how we talk about ourselves. And that is
Ah,
obviously a big thing for me. I'm like, we need to stop disappearing, stop putting ourselves down, stop putting ourselves at the bottom of the list. And you don't want to have that like everything is positive and good, but just knowing yourself and knowing what you can
it's
bring.
really interesting because one of my previous interviews was with a death doula, Diane Murdoch, who studied, end of life and so on and so forth. And of course, across cultures, the handling of death and is very, very different. But one of the practices that she offers to people with whom she's working, families, individuals, is to write your own obituary. Write it yourself about yourself. So when you're talking about how we talk about ourselves while you're alive,
Hmm.
and not sort of the legacy for your obituary, it's all part of this way of how do you see yourself and how do you want others to understand who you are? And then
Yes.
eventually Diane's Write Your Own Obituary kind of is a next follow on because then you're, the legacy you leave behind. But it's while you're working on what will ultimately be your legacy is how you talk about yourself. So it does reframe how you then advocate for yourself and that you suddenly have this sense of, yeah, you know what, I need to push harder to get the right care for me for where I am right now. And I think it
Yes.
all ties together beautifully. So, wow, you really helped us get from the punchline to where it's really a serious but important and achievable goal because I think we sometimes get very overwhelmed with all those algorithms and idiot, stuff that isn't true, but it's hard to sometimes kind of know where to go to feel like you're getting real information that's not junk. And we'll put these links up. And
Thank
like I do
you.
with everybody, I can't let you go until you share with us your favorite song. We actually on Spotify now have our Health Dame playlist is up and running. So
Ooh,
yeah,
I'm
so
getting
you
on
will be
that.
the first addition to 2026. So we must know, Sarah, what is the song you would like that best reflects either your favorite song or the work that you're doing?
I would say it does both. The song is called Super Bloom by
Super.
Mr. Wives. And it is a song I found a couple years ago. I am a big time trail runner, and I was running my first ultra marathon trail race. And I
Holy
put this
mackerel.
one on repeat during it because it is all about resilience and overcoming. It's one of the phrases I love is like, I deserve congratulations because I survived. And it's talking about super blooming. It's like when things are hard, not only do you bloom, but you get bigger and better.
Oh, I
So,
love that.
oh, it's fun and it's very motivating.
And who is the artist?
Mr. Wives. I had never heard of them. I found it because Spotify knows me better than I know myself
Yes,
and
well, there's that
played it to me.
algorithm.
Yes, exactly.
Yeah.
I will say in my Spotify review, it thinks I'm 24 years old. So I don't know, but
Oh, that's
I
funny. I have to look and see what they think I am.
I was
Probably
like, I guess I'm
120.
listening to 20-year-old
Younger
old music.
music. Younger.
Uh, but it's always a mix between CCR, Elton John, and then like things like Mr. Wives that I have no idea how they got that name, but
That's
we just go with
hilarious.
it. Yeah.
Oh, I can't wait. I'm going to go listen as soon as we're done. I don't know that one. Usually I know most of them, but this is a new one on me. So that's great. Well, listen, thank you so much for taking the time. I'm really excited about the information and everything that you shared with us. And we will get this on healthdame.com
Yay.
and we will be back in touch. So you have a great day.
Yes,
And
you
everyone,
too.
ladies in particular, make sure that you go and get the information you need and that you really don't be shy because at the end of the day, you're your own best advocate. So thank
Yes.
you, Dr. Sarah Berg. Thanks very much. Bye, everybody. Take care now.
Bye.